Welcome. Good evening. I'd like to welcome everyone to the COVID-19 recovery, listening to our community public forums. I'm Jennifer Kirkham, and I'll be facilitating tonight's session. The City of Brantford recognizes that the COVID-19 pandemic has resulted in severe and unprecedented challenges in the lives of our community members, including but not limited to challenges concerning physical health, mental health, finances, and spirituality. Our goal is to gain a better understanding of the specific supports needed to help our community endure and recover from the COVID-19 pandemic. Over the last 2 weeks, we have shared information about how community members can participate in these virtual public forums, including registering in advance to speak live, submitting feedback through the Brantford Let's Talk webpage, and watching the live streams on the City of Brantford's YouTube channel. At the conclusion of these 4 public forums, our next steps will be to report your ideas, concerns, and questions back to City Council in order to advocate on behalf of our community to the provincial and federal levels of government. We will also provide a summary of this information to the community. City staff are joining me tonight and will be capturing the comments and questions from the speakers that we have. Tonight's topic is mental health, and we will be looking at 3 different questions around that. So what did we do well as a community to support each other during the COVID-19 pandemic? What are the needs of the Brantford community as we move forward? And what can the municipal, provincial, and federal governments do to support pandemic recovery? The City of Brantford welcomes open and honest communication. However, we uphold zero tolerance for hate speech, profanity, and other inappropriate language and conduct. Participants who engage in these behaviors will be removed from the meeting. Examples of inappropriate language and conduct include verbal assaults, threats and attempts to intimidate, attempts to goad or incite violence in others, or racial, ethnic, religious, sexual, or gendered insults and slurs. I have a list of registered speakers for tonight's topic around mental health, and I will call on you when it's your time to speak. We'll start, just so you have a sense of the order, we'll start with Kim and then move on to Melissa and Susan. And if others join us, we'll continue on with the list from there. Each of you will have up to 10 minutes to speak, and I'll provide a 1-minute warning as you get close to the 10-minute mark. So I'm going to actually invite Kim. Welcome. You're our first speaker tonight. So welcome. You'll be unmuted and you'll be able to chat with us.
Great. Thank you. Can everybody hear me okay?
Yes, we can hear you. Thanks, Kim.
Thank you. Thank you and good evening. My name is Kim Baker. I'm the Director of Clinical Services at St. Leonard's Community Services. So I oversee our addiction and mental health department and the dozen or so programs within it. It's indisputable that we faced an unprecedented global health, social, and economic crisis, and the health and social service world is bracing for the continued and long-term impacts of this pandemic. The sustained isolation, financial struggles, and the lack of access to care and support have taken a very real toll. Surveys conducted by the Canadian Mental Health Association Ontario and the Mental Health Commission of Canada have tried to quantify these impacts. Stress levels have doubled. People are fearful and uncertain about their well-being and the well-being of their loved ones. Half of Canadians say that their mental health has worsened, with 10% saying that it's worsened significantly. 40% of Canadians report feeling anxious and worried, and over 20% of Canadians say that they've increased their alcohol use during this time. This impact is occurring locally as well. Our agency, in the best of times, serves about 5,000 people a year across all of our mental health and addiction programs. In the past year, we've seen demand grow for things like our crisis line and crisis outreach. We've experienced a 44% increase in call volume to the crisis line over the last year compared to the year prior. And we've had a 65% increase in referrals to our crisis outreach service called COAST compared to the year before. And it isn't just an increase in volumes, but also the depth of need, the profoundness of people's struggles. And these needs are not diminishing, even as we better manage the virus. These issues persist. We have worked really hard to serve the community during this pandemic, including continuing in-person services for people who needed it most, since the onset of the pandemic in March 2020. This has also challenged our staff, who are not immune to the impacts of the pandemic as individuals, but also manage the additional layer of responsibility for helping vulnerable others. Our agency is very grateful for the additional resources we received from all levels of government to shore up our staff and services during this time, but short-term resources do not help us face a long-term challenge. The pandemic has highlighted our pre-existing vulnerabilities as a helping system. We need sustained investments in our mental health and addiction services, not just for now or 6 months from now, but well beyond this pandemic. We would ask that all levels of government fund addiction and mental health services adequately, commensurate with the financial and personal toll that these issues take on our communities, including long before the pandemic existed, so that we can effectively provide care to all who need it. Thank you.
Thanks for your comments, Kim. I'm now going to call on Melissa McDonald. Welcome, Melissa.
Good evening and thank you. Melissa McDonald from Guiding Hands Coordinated Services. I'm going to second pretty much everything Kim had to say there. You did hear from me last night, and I touched a bit on some of the mental health challenges that our community is facing and that the individuals that I support are facing. I support individuals with developmental disabilities, many of which also suffer with both mental health and addictions issues. And we are seeing a growing trend within our developmental community in terms of addictions issues, which is something that 20 years ago was not as much of an issue as it is today. And that has become an increasing problem in terms of the hard street drugs that we're now seeing being utilized by the individuals that we support. And as I mentioned yesterday, our vulnerable people are becoming more and more targeted by dealers that have come into this community, and we need to be doing more. So I will address your questions actually in the order that they're phrased here. So what did we do well as a community to support each other during this pandemic? Well, we did rally as a community at the beginning of the pandemic, which was nice to see. So there were things like the Neighbors Helping Neighbors group that did come together. So that was a nice thing to see. We saw some bright lights come popping out in the community, like BL's Little Pantry. Agencies and organizations like the Brantford Blessing Center, Soup for the Soul, adapted quickly and were able to adjust and serve the community needs. But a lot of other agencies ended up hampered by the COVID restrictions in how they were able to provide supports, and those one-on-one supports were no longer provided. And that's what has led to a lot of the difficulties moving forward, and what's led to a lot of the needs in the current community that we will be facing and having to undo the damages that have now occurred because of the social isolation that people have had to face during this pandemic. The mental health issues have skyrocketed a lot of the time due to the increased social isolation that they faced. They faced a mountain of fear that came with this pandemic. They faced a mountain of fear about what their future is going to be, what's happened out there in the world, what's happening with this illness, on top of sometimes underlying mental health issues that were already brewing within our own community, on top of possibly addictions issues. And addiction has skyrocketed because one of the things that did stay open through all of this was, well, LCBOs and places like that. And of course, well, our dealers and things like that are available in the community never shut down. We need to clear our wait lists, because wait lists for services are definitely something that has hampered and hindered individuals from being able to access the services that we needed and that they needed. Our wait lists are monumental, and we've never seen them at the levels that they're sitting at currently. People are being waitlisted for services across the board because the funding just isn't available to be able to support them. An example, case management. If an individual requires case management under developmental services, currently the wait list is 1.5 to 2 years minimum, and that's if they rank high enough to require that support immediately. So that means that if somebody has scored high enough to be able to say that they are in imminent need, absolutely desperately need that case management support, their medical conditions are significant, or they're in absolute crisis and need that case management support today, they will get it 1.5 to 2 years from now. That's a concern. That is a significant crisis, and that is a problem. We can't be putting out fires 1.5, 2 years from now, because they will just rage. We need assistance for people to find and learn about how to access programs and funding. So many people don't know how to find what's available to them. We have individuals that have literacy issues, that have difficulty reading, and we are posting lists on this is the supports that are available to you. And because of the COVID isolation, it's not like they can walk into a program and say, but I need to know, I need to know. So now that things are starting to open up, they have the ability to walk in, but during the lockdowns, they didn't. And if we go into another lockdown, what happens? And they have the fear of what happens if we do. What happens if we lock down again? I can't handle it if we lock down again. We need more information sharing amongst professionals, because this isolation has hit us as well. Across sectors, we haven't had the opportunity to communicate and share information the way that we did. Programs that have been impacted, cuts that have happened, or changes that have happened are not being able to be shared across our sectors. So if there have been changes in the mental health sector, if there have been changes in the developmental sector, if there have been changes to ODSP, we may not be aware of them because we haven't had the opportunity to share them openly with one another. Where we used to have the opportunity, because we would connect with each other at various meetings, group sessions, training, seminars, those things are not happening because everything is virtual. We need to come back together to be able to have those sessions and share that information. There needs to be a group forum to be able to share more information, and virtual is, as much as it's necessary right now, is not the best way to be sharing information with one another. The push to move everything virtual also put us in a position to have to buy devices, electronics, all kinds of things for our individuals to be able to support them to stay home and stay safe. Now the need is to get them out into fresh air, sunlight, daylight, because that blue light is not helpful and not healthy for them. It actually aggravates mental health conditions, and there's a number of studies that prove that. So sitting at home, hiding in the dark, looking at all of these blue lights has not been well and healthy for them. How do we now motivate them to get back out into the community, get out into the fresh air, and actually get moving? So we need some wellness and fitness campaigns to encourage that. We also desperately need in Brantford a positivity campaign, because the entire essence of what's going on across Facebook has become rather negative about our community, and it's concerning. I have continued to see people slamming and just really downplaying what's happening in our community because of their concerns about the state of our city, the state of the homelessness. There is a real sadness that's hitting people about what's happened to our town. And we need a positivity campaign. We need to celebrate the positives. We need to talk about what we love, because that is going to be very detrimental to our entire community's mental health. We also need to do our best to bring in more therapies across the mental health board. So I'd love to see some additional opportunities for DBT, for CBT to be offered, where people don't necessarily have to be either paying for them or registered with a specific agency or on a wait list to be able to get it, because people are waiting too long for these therapies and they need them now. I think I've covered everything on my checklist. So I am very hopeful that some of these things will come back and go. We'll go out to the province, we'll go out to the various levels of government, will be looked at as a possible recommendation because we need to see some change. Thank you.
Thanks for your comments, Melissa. I'm now going to welcome Susan. Thanks for joining us tonight.
Hello, thanks for the opportunity to speak. It's Susan Zudima. I'm the Executive Director at Why Not Youth Center on Colburn Street. And we work with teenagers from the age of 13 to currently about 20 or 21 years old. I want to talk, I'm really glad to be able to talk about the topic of mental health because what we've been seeing throughout the COVID-19 pandemic has been alarming. And I feel like that's not a strong enough word for what we've been seeing. We've seen an dramatic increase in suicidality and in self-harm. The self-harm we're seeing right now is very serious and just points to levels of toxic mental health that we really haven't seen. So at Why Not, we deal with kids who are already at risk, kids who are already struggling with pre-existing trauma, generational poverty, addictions in the home, and so on. So these kids are already at risk of kind of being behind the 8 ball in life. And what we've seen throughout the pandemic is that the isolation and loss of relationships has had an amplified consequence in terms of their mental health. So mental health is suffering. We've seen kids frustrated and the mental health declining because they can't achieve their goals. School has become impossible. I think we track several dozen kids at Why Not, and I'd be surprised if among all of them we got more than a dozen credits in high school for the past 3 semesters. So the format is not working for these kids. Why? Because they don't have Wi-Fi at home. They don't have devices. The schools will give devices, but Wi-Fi is spotty. Typically kids would access Wi-Fi at Why Not, but we've been closed a lot of the time. So they can't go to school, they can't achieve their goals, and they feel very strongly that they're falling behind, and that is very stressful. At home, their families are failing. There's a lot more tension. There's a lot more trauma happening. Parents are having their addictions come to the fore again. So kids are suffering as a result of that. Their housing situation is unstable. They don't have access to resources, and a lot of them are turning to drugs in order to cope. What we've seen is a lot of kids using drugs, not for recreational reasons, but just for self-medication. So they're trying to calm down, they're trying to deal with their anxiety. Before COVID, I would estimate that about 15% of our youth occasionally used cannabis. And at this point, I would say it's probably more like 75 to 80% using cannabis. We've started to see cannabis-induced psychosis in our youth, and that is truly, it's terrifying to see that starting to happen, but that is starting to happen among our youth at Why Not. Something else that's caused mental health to decline and continue to decline is the lack of psychiatric care and follow-up that they have access to as well. So what does Brantford need moving forward, and what can the government do to help Brantford? I'm kind of thinking of those questions sort of hand in glove. But because of the isolation and the loss of relationships and the direct correlation to decline in mental health, our youth cannot tolerate more lockdowns. When they lose access to supports like Why Not, like school, it affects them very negatively. And so I really feel strongly that lockdowns are hopefully behind us and that we can move forward without them. The youth and their inability to achieve goals and the impact that that's had on their mental health and their level of despair. I just have to report to the group here that the quadmester system is failing our youth. They can't function in that kind of a program. It's not working. So I'm really hoping that Brantford can go to a semester system again for next year, because that directly correlates to success, which impacts mental health. I mean, if we can actually address the reasons why mental health are declining, I think we would actually go a long ways toward improving mental health. And I think that the failure of high schools to come up with a workable system is a really big contributor to the poor mental health in the youth. General Wi-Fi access, if it is going to continue to be online, is important, just to actually make sure that everyone has access to Wi-Fi, level playing field for all the kids. Therapy. I've been really glad to hear I believe Melissa spoke about the need for therapy, DBT and CBT. I would echo that. Our youth are literally crying for therapy. We've been able to hire a therapist to come in and talk to 4 of our youth, 4 of several dozen so far, the ones that were kind of floated to the top of our list, but we would love to see all of our youth have access to some of the strategies that they can learn through group therapy with DBT or CBT, and more funding for therapy right at the source. So places like Why Not and the Youth Hub, so on, having therapists right on hand in order to deal with these issues and help the youth right where they're at, where they're comfortable. Kim spoke about, and Melissa as well spoke of the failure to keep up in terms of the beds and detox and long-term treatment. I echo that as well. We have had serious frustrations trying to get kids who are ready to change, to stop using hard drugs. We're working on, like, 14 months later, we're still trying to figure out something for some of these kids, and it's very frustrating because they lose hope. So we need a lot more beds in our detox facilities and in long-term treatment, and for concurrent disorders as well. When we're talking about long-term treatment, the ones, programs that can deal with mental health alongside addictions. I would also like to put a plug in for a youth safe house in Brantford that is self-referred. We've been so frustrated that the Brantford safe house, or the crisis stabilization bed, in Brantford is only police referred. We've had kids who are so suicidal, and they want to get admitted to the hospital, and the hospital will turn them away every time. And they really need to be able to self-refer to a place where they can achieve stability and just be taken seriously. That isn't necessarily the hospital. So that's a very big need for our youth. And something else that our youth will also say is that they need to have the ability. I asked them the question, if the government gave you $1,000 to spend on your mental health, what would you do? And almost all of them said, I would take the money and put it in toward housing for myself, because I want to get out of my house. They realize how toxic their home environments have become over COVID, and they feel like that's the number one thing they would do to improve their mental health, along with several of them mentioned therapy to cure their PTSD. And I want to put also one more word out there to do with masks, because one of our youth asked me to let you know that the shaming that happens for those who can't wear masks, those who have extreme anxiety and so on, the shaming actually increases the anxiety to the degree that they can't leave the house. So while masks are necessary and important, it really does create a problem for people who just simply can't wear them. So I believe that's all my points. I thank you for the chance to speak today, and look forward to seeing the outcome of this conversation.
Great, thank you for your comments, Susan. We do have some time, so just wondering if there are any additional comments that any of the speakers would like to make, or any other final questions or comments. If you do, please just raise your hand. Melissa, go ahead.
I think additionally, one of the things that we need to talk about is the impact that the lack of housing is having on mental health. People are staying in homes that they are not comfortable in because there is no place to go. They're avoiding leaving bad situations. They are sometimes camping out down by the river because there's no housing and they're afraid to go to our shelters. Um, it's dire, absolutely dire, and it is desperately impacting our mental health. And there is something that desperately needs to be done about that. We need better options for housing. Housing needs to change. And I'm sorry, I'm gonna say we need to reopen the Welcome Inn or find another option there as well, because we just do not have enough shelter beds either. We should not have as many people needing to sleep in parks and sleep along the riverfront as we do. There's just not enough in terms of shelter beds. Thank you.
Thanks, Melissa. Susan?
It always happens as soon as you finish speaking, you think of something else. But if I had my way, and if I could, kind of direct how funds get distributed, I would do it this way. If you picture poverty as a cycle, which it is, we know where somebody starts in a situation that is, generationally impoverished, or addictions, and roots of trauma, that situation tends to create more trauma. And then from there, we end up with mental health problems, kids failing at school, people who can't be employed, addictions, and so on. And so I really think that one of the keys to improving mental health is to dial it right back to the source. I mean, we absolutely have to fund and address the symptoms that come out of poor mental health, for example, addictions and so on, unemployment, housing. I like what Melissa just said about the homelessness situation. I fully agree. These things have to be addressed, but the more that we can go back to the source of the problem, which is the root of trauma, and what's happening, in someone's formative years, I think that would be the wisest place to pour significant resources, because if we can get therapy, we can get kids and adults dealing with the roots of their trauma and the roots of what's caused them to get addictions and so on, then we can shift the trajectory. And instead of it being a cycle where they end up back where they began with the new generation, we would see them actually going off in a different direction and having more success. So at Why Not, that's what we've been trying to do, is looking at the roots of what's causing these issues with the kids. And we did a lot of mapping with them when they set goals and so on. And we realized it really just came down to that generational piece, that early trauma. And if we could get the kids on a different track in dealing with their trauma and their root issues, that would go such a long way toward changing their outcome. So I just wanted to add that piece.
Thanks, Susan. Any other comments? Kim, go ahead.
Thanks. I'll just add quickly to what Melissa and Susan had both said. One, just in terms of the lack of access to a full continuum of affordable and supported housing within our community for all ages. It certainly is a significant and conflating variable when we're trying to provide support to individuals who are struggling with mental health and substance use issues. I would also echo the sentiment around trauma and trauma-informed care. Trauma-informed practice is not trauma treatment. And again, it's a significant contributing variable to the challenges of many of the people that we serve. And there's certainly limited access to those things within our community and many communities across the province. Thank you.
Thanks, Kim. So I'd like to take this opportunity to thank Kim, Melissa, and Susan for taking the time tonight to share your ideas, concerns, and questions with us. If there's any other information you'd like to share, please visit the Let's Talk Brantford COVID-19 Recovery webpage to have your voice heard. Same for people who are watching us live on YouTube. If you have some thoughts about mental health, please feel free to go to that webpage and provide your thoughts that way. As I mentioned when we started, all of the information that you shared with us will inform a series of reports back to Brantford City Council to support the ability of council to advocate on the community's behalf to the provincial and federal governments. A summary of these reports will also be made available publicly. I'd also like to take this opportunity to remind everyone of the health and social support resources that are available in our community. And you would have seen them on the screen just a minute ago. So there are many different types of resources. We also have 2 more public forums next week. So on June 21st, we'll be talking about financial support. And then on June 23rd, we'll be talking about spiritual support. So if you would like to speak on either of those 2 topics, please feel free to register and to speak and or to share your thoughts on the webpage. So I hope to see some of you again next week when we finish off with the last 2 public forums. Thanks everybody, and I hope you enjoy your night.